Welcome to another installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that show that talks about all things Gateway Community Health Center, and this show is no different as we take a dive into our Gateway Residency Program here at Gateway Community Health Center. First up, we'll talk to Dr. Maria Antonieta Garcia, our Family Medicine Residency Director, who highlights the process of what it takes to create doctors right here at Gateway Community Health Center. Then we head over to pharmacy and sit down with Dr. Cesar Banuelos to talk about some really cool new medications that patients may be able to benefit from right here at our pharmacy. Then we'll meet a new face to the Gateway Community Health Center dental family. She's Dr. Sarah Modi, and she'll tell us all about her experience in joining Gateway Community Health Center. We got a lot of show to cover, so make sure you sit back, relax, kick your feet up, because another installment of Gateway Today starts now. Welcome to Gateway Today. Well, this show is jam-packed with a lot of information, and we're going to kick things off with Gateway's residency program. What is a residency program? A program designed to help doctors after medical school. We'll tell you all about it as we sit down with Dr. Maria Antonieta Garcia. Check it out. Welcome, ladies and gentlemen, to this installment of Gateway Today. And one of our familiar faces on the program is joining us again. She is the program director for our Family Medicine Residency Program. Dr. Maria Antonieta Garcia is with us. And Dr. Garcia, thanks for joining us as always, enlightening us, because today we're talking about residency. And I love this topic because I don't think many folks understand how important this program is, not only to Gateway, but to the community of South Texas.
Thanks for having me. Good morning.
Good morning.
Residency, yes, is the last step in the process before a doctor becomes a fully fledged doctor who can practice independently. So before they come to residency, they graduate from college, 4-year degree. They go to medical school for 4 years, and then in the last year of medical school, they decide what they want their specialty to be. Once they decide, then they can apply for that specialty in a process called the match. And once they interview at several places, they can be chosen by a program that they also choose, and they match there. And once they match, they are employed by that program for the next 3 to 7 years, depending on the specialty that they choose. Here with Family Medicine, we keep them for 3 years, and we get applicants from all over the country who want to come and train with us here in Laredo at Gateway. And so they're here with us for 3 years, learning about medicine, how to practice independently under the supervision of a doctor who has already graduated from residency, has their license and their board certification. So we have that here at Gateway all 3 years. And we're currently in our 7th year of existence in this program. And we've graduated 5 classes so far. And from those 5 classes, together with our internal medicine residency partners at the hospital, we've kept over 17 doctors from those that we've trained, and we take 8 every year.
Well, that's exciting, and that's sort of the goal, right, of residency, is to keep these doctors, make them and keep them here. But I want to ask some fun questions about residency. Tell me about the applicants and the type of applicants you're like, where they're coming from. Tell me how far away folks are coming from just to be a part of this program. What parts of the world are they coming from?
So some of our residents have applied that are from different countries. They went to medical school in Bangladesh. They went to medical school in China, but they are citizens now of the United States. Some of them were doctors in their respective countries, but cannot practice medicine until they've done a residency in the United States. So we've got doctors from all over.
Yeah, that's exciting because I think culturally, when they get to Laredo, their experience is something unknown to them, right? And they get a chance to really experience Laredo and all the great things that our city has to offer them. Now, tell me about that process. You talked about it. I obviously know it's called the match, right? So tell me about the match process. What is that like?
In the eyes of a medical student, it's extremely stressful. I went through it many years ago. And you apply to programs that you would like to train at, and the program can decide if they offer you an interview or not. If you do get an interview, nowadays many programs offer virtual online interviews. We here in Laredo, we offer in-person interviews. So those that come to interview with us come from their city, they fly in, they stay in Laredo. We take them to dinner so that they can experience the culture a little bit. And we have an interview day where we talk to them about their application. That includes their board scores, letters of recommendation, their transcripts, personal statements. And after all the interviews are done, if you're a great candidate, you get several interviews. We make a list of our top people that we interviewed. And then they make a list of the top programs where they interviewed. And then an algorithm decides where you end up for the next several years. So when the residents come to us, they are fully fledged MDs and DOs, which is an MD equivalent.
They are real doctors.
Yes, they're real doctors. They've graduated, they have their degree. They're just learning a little bit more under supervision of doctors who have been practicing for a longer time and have graduated from residency and are board certified and licensed. So that helps the resident become a little bit more comfortable with managing patients on their own. Medical school is a lot to learn in a little bit of time. So this gives them a chance to apply everything that they know to an actual patient. And so for the patient, it's actually beneficial because you're getting the opinion of two doctors always, the resident and their supervising attending.
That's awesome. And obviously the fruits of your labor. Now, tell me about your core faculty, right? And the physicians that are actually working alongside you that are teaching these physicians to be, fully licensed physicians. Tell me about the core faculty and what each of their roles is as they sort of guide the students.
So we have several community faculty. A lot of doctors in this town pour their heart and soul into teaching these residents, making sure that they're up to snuff to be unsupervised physicians when they graduate. And so we really appreciate the support that we get from the community, because without these local physicians, we wouldn't be able to do this. We also have on our side at Gateway the core faculty who are with them most days, who are their advisors, who make sure that they're making the grades. Some of them are graduates from our program who have chosen to stay in Laredo. Some of them are native Laredoans who have come back to help the cause of...
Like yourself?
Like myself. The need for healthcare in this town. And some are not even from Laredo, but are interested in what we're doing here and came to join us.
Now, from your perspective, and this is maybe a question that neither you or I could answer, but just, we're medically underserved here in South Texas, and it's been a mission of ours. Off camera, you and I always talk about this, but how do we work to keep these physicians here? Would you say that's probably the biggest challenge of residency, once residency is complete, is keeping doctors here?
That is the goal of the residency, is to make doctors for our town. Of course, I can't force them to stay anywhere once they've graduated. I'm no longer their boss. And I think we've done a good job of retaining many. I think recruiting them, making them feel welcome, and most of them do. Some just cannot stay. Their families are elsewhere. They're required elsewhere. But just making sure that we continue to support them, because they are not, most of them, Laredoans. So making sure that we get them patients and...
Yeah. She's the mama doctor, mama physician of all the physicians in our residency clinic. Dr. Maria Antonieta Garcia. Doc, thank you as always for enlightening us and giving us a firsthand look at what residency is all about. Thank you for your work and all the knowledge that you're putting into these future physicians that are getting ready to treat all of our patients out there. So thank you for your time. And thank you all for watching this installment of Gateway Today. Our thanks to Dr. Garcia for walking us through the residency program. We are excited to meet our brand new doctors right here at Gateway Community Health Center. Well, we're headed over to Gateway's pharmacy to sit down with Dr. Cesar Banuelos to talk about the new wonders of medication. Check it out. Welcome to another installment at Gateway Today. Well, look, I'm excited because he's my favorite guest that I always like to pull from the pharmacy and bring onto the program and talk about medications that are breakthroughs, medications that we may or may not know about. And I wanted to bring on Dr. Cesar Banuelos to speak about these medications and talk about some of the different breakthroughs that are coming through. So Doc, thanks for coming onto the program. I appreciate it. There's a lot to cover, and you sent me a couple of notes, and I want to make sure that we run through them and talk about, okay, so let's talk about antimicrobial resistance.
Yes.
Okay, so let's talk about that because this is a big one. We were talking about antibiotics our bodies becoming resistant to antibiotics.
So microbes becoming resistant to antibiotics, yes.
Okay, so
bacteria.
So I get sick traditionally, and I would get this antibiotic that is given to me. Mm-hmm. Our bodies are changing in the fact that they might not be as effective as they once were, or what we once thought. Is that correct?
What we're seeing is the microbes are basically becoming resistant to the antibiotics that we give. So they're developing certain traits that's causing them to be able to avert that actual antibiotic that we usually use to treat. So let's talk about that. So antimicrobial resistance is basically the resistance of the microbe itself, be that there's tons of different bacteria. But basically, the microbe itself will no longer be able to be treated effectively with that antibiotic, right? Now, that's one thing. But what we've seen in the literature, and this paper was recently published, was that because of that resistance, they did a trial that looked at a time span from 1990 to 2021. And what they saw was that 1 million people died, and that was attributed to this resistance that we saw. And so if we follow this trend, and if it trends on for 25 years, we can see a 70% increase in those deaths.
So what is science going to do, or what do you think science will do with this data if it turns out to be a factual trend?
And so that's very interesting, Dave. So let's talk about specifics in the trial. So in the trial, there was a bug that actually the amount of deaths attributed to that bug actually decreased. So they went from 250,000 to 150,000 over that time span. What has happened during that time span is that we've had more production of certain vaccines, that be the pneumococcal vaccines, and there's been so many that have come out in the last couple of years. And so what we're seeing is that there could be a correlation between the production of these vaccines and the diminution of this bug, which is called Streptococcus pneumoniae. Classically, this bug causes ear infections, pneumonias, certain infections in the nervous system.
And so what this means is basically, as we start to develop as a human race, we become more susceptible, even with these antibiotics, to these bugs, right? That could potentially turn deadly.
Yes, because the bugs themselves are adapting to what we're throwing at them, basically. It's an adaptive process. There's a bug called MRSA, and we always called it the king in school because it's always adapting. And if we look at it over the course of time, it's adapted every single time we throw something at it. And in the trial, it was the most deadly. It was the one that caused the most deaths in the trial.
So for the public watching right now, is it better for us to try to sort of, I don't want to say not go to the doctor or not take medications or anything like that, but is it better that we try to reduce the amount of antibiotics we put into our body to maintain a resistance against these bugs?
So I think the best thing to do is, go see your doctor when you have an infection. And the reason for that is when we use antibiotics, we try to do it with finesse. So what we try to do is give someone an antibiotic that will treat the specific microbe that they have. Because if you go and give something that treats, it's kind of like going in and giving something that can kill a whole bunch of microbes versus one. If you show everybody your cards, then all these other microbes have the ability to adapt because you've already showed them that antibiotic.
So later on, when I get a different sickness, it might not be as effective because I've already used it too many times, is what you're saying.
Those microbes develop resistance, and over time, your body the microbe might not be susceptible to that antibiotic.
Man, I'm telling you, the human body is such a beautiful thing because, again, as time goes on, we continue to evolve as humans. But there's a lot to cover, and so I want to talk about penicillin allergies.
So
tell me about that, because from the dawn of time, right, we've considered penicillin was like this wonder of medicine that would cure everything. What's happening there?
So penicillin is still a big part of our treatment plans, and I wanted to make it known that if we take penicillin or antibiotics that are like penicillin or fit into that family, we're basically robbing that patient of something very significant. It's able to treat a lot of things, and it's able to do it very well. To this day, we use penicillin still to treat syphilis, and syphilis has been around for many, many years, right? Now, what I wanted to point out was that 10% of the population has a penicillin allergy, or self-proclaimed, or a doctor put them as having a penicillin allergy. But from that 10%, only 5% have a true penicillin allergy. So there's different types of allergies to penicillin, and the one I really wanted to focus on was the immediate type. So basically something that happens within minutes to hours. So basically the patient would get penicillin and their body would react to it because there's certain chemicals that are released by some antibodies. And so when that chemical release, there could be, a rash, but more importantly, there could be swelling to the throat that could cause you to not be able to breathe.
To suffocate, right?
Right. And so, very scary stuff, right?
I'm excited that you're bringing all of this to light, man. I know we could go on and keep on talking about more medications, but I do want to invite the public to get familiarized with our pharmacy, and that's specifically for our patients. So if you want the type of professionalism and knowledge that this man brings, why? It's true. He does. He's a wealth of knowledge, and I love having him on the program. We're going to bring him back on, but for the meantime, if you want to get that type of service and be that type of patient right here at Gateway, you can do so by visiting gatewaychc.com. He is our pharmacist here at Central Clinic, Dr. Cesar Banuelos, on the program today, right here on Gateway Today. Our thanks to Dr. Cesar Banuelos. Always a fun time when we get a chance to speak to him about the latest and greatest research within the world of medications. Well, coming up after the break, we're going to talk to a brand new addition to Gateway's dental department, Dr. Sarah Modi, coming up right after the break. Stay close.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we'd introduce you to a brand new face to Gateway's dental department. Her name is Dr. Sarah Modi. Check it out. Welcome to this installment of Gateway Today. Well, we have a brand new face and a brand new guest to the program. She is the newest addition to the Gateway Community Health Center dental family. Dr. Sarah Modi is joining us on the program. Dr. Modi, welcome.
Thank you.
Fresh from West Texas, right?
Yes, sir.
But born and raised
in Chicago.
All right. So tell me about that story. How did you end up here in Laredo?
Yeah. So I was born and raised in Chicago. And then when I was 14, I moved to West Texas, a super small town, population of about like 2,000, only one street light, 1 mile in every direction. You blink and you're out of the town. And I came to San Antonio for undergrad and then dental school. And so I kind of always liked the idea of kind of like not like a super big city like Chicago, but not super small either. And Laredo just seemed like a perfect match.
Yeah, we're right in between the big city, bright lights, and a rural community, right? And we have a Dairy Queen like West Texas, right?
Oh, yes, of course. That's like the only fast food we had in West Texas. But
what has been that thing for you in dentistry that you're like, man, I love this about dentistry? What do you love about the work that you're doing so much?
So one thing I really like is when I'm like removing teeth and things here, it's usually with patients that are in like horrible pain and they're like, I can't sleep, I can't eat, you know, things like that. Like they just look so frustrated and everything. And then as soon as we get that tooth out, they're like, oh my God, it feels like I lost like 15 pounds or something. Like they feel immediate relief. And so that's just really nice knowing that, you know, it's not going to take them like weeks or months to feel better. It's like literally by the end of the appointment. Like, of course, getting a tooth taken out isn't the most like comfortable at first. And then, you know, you might have a little bit of soreness afterwards, but they're like, anything is better than the pain that they were in, where they couldn't sleep or eat or really do anything besides
I've had tooth pain myself where I've actually had to have an extraction, and it is not pleasant. You don't sleep. I mean, the pain is excruciating, and it's just a throbbing pain that you just want removed immediately, right? And so you bring that relief through your work, and you know, for the folks out there that, and this, you know, again, I love having the professionals here to talk about it, but for the folks out there that think, oh no, I can put off my visit to the dentist or put off dental care to the very, very end, what do you say to those folks that, you know, haven't visited the dentist? Why is it important to come see the dentist?
The thing that's interesting about cavities is they grow super, super slowly. So if you go one day and, you know, you don't have a cavity, in 6 months, if you go, they're not going to tell you, most likely, they're not going to tell you like, oh, like, you know, that tooth that had no cavities on it 6 months ago now needs a root canal. Like the first step would be like, oh, it needs like a filling or something like that. Like they progress so slowly through the tooth that there's no way if you go every 6 months that it would become so bad that it would need a root canal in like a month and a half after your last visit.
Right. So the visits, a regular 6-month visit is extremely important. That's the advice, right?
Yes. Because if you go every 6 months, you can prevent having like, you know, massive pain, possibility of infection. And then you also have less traumatic dental experiences because when you come in, you know, you're just kind of getting used to the environment. You're getting used to seeing our faces, our dental assistants. You're getting used to seeing like a mirror in your mouth, keeping your mouth open, taking x-rays. And then when you have so many positive experiences of, you know, just coming in for checkups, maybe small fillings and things like that, that in case anything happens, like your tooth fractures, you're not having the idea that, you know, like the dentist is a horrible place. And with my sister too, I convinced her, and now she's been going every 6 months, and she's like, yeah, like, she's like, I still don't love the dentist, but I'm feeling a lot more comfortable.
Well, I think she
going.
has to love it somehow because her sister is a dentist, right?
She says she loves me, but not dentistry.
Well, you know, and finally, the fun question, right? Because I always have this constant debate. So is brush, floss, mouthwash the order? What is the order, Doc?
So, first off, I recommend a mouthwash that does not have alcohol. It's extremely drying. A lot of people think it's like really good because it kills all the bacteria in your mouth, but not all the bacteria in your mouth needs to die. Okay. Some of it is good and it's good to maintain. So I say actually, it's kind of controversial, but I say to floss, and then you can do like a mouthwash. You can also switch it between, so you can do mouthwash first and then flossing. But the last step should always, in my opinion, be to brush, because if you brush, that has a stronger, like a higher amount of fluoride. So those minerals in a higher concentration will help prevent the growth of more cavities and things like that.
Gotcha. What about teeth whitening?
Teeth whitening.
Peroxide and baking soda, or what's your thought on that?
So those things tend to really thin out enamel, which is like the outer layer of your teeth. It's what a lot of people say, they say that teeth are like little diamonds. So when you use like abrasives like that, you're slowly peeling off the outer layer. And as you start peeling out that outer layer, you're gonna get to the inner layer, and that inner layer is gonna be a lot more sensitive to like water and air and everything, because you're getting closer to the nerve. So I would say to be careful doing it with caution, because you don't want to do that. And that's the same with like using charcoal toothbrushes and toothpaste, which I know is like a very popular trend. Right. Your teeth are getting whiter, but it's not because it's whitening your teeth, it's because it's taking out the outermost layer. You're shaving down your enamel. Yeah, right. You're shaving down the outer layer, so a new layer is being exposed. So it does look whiter, but it's not. You know, because it's removing a layer. It's a new layer. It's social like media, skin. Social media will try to convince us of all these different remedies, and I'm glad we have a professional here. So for those of you out there doing those TikTok challenges, you may want to think twice about it. She is a friendly face that you would love to see inside the doctor's office, and she's here with us at Gateway. She's our newest dentist, Dr. Sarah Modi. Thank you for your time. This was super fun. I love it. Come back. Definitely was. Yes. Anytime, let me know. Make sure if you want an appointment here at our dental clinic, you visit gatewaychc.com or call 795-8100, area code 956. We thank you for watching this installment of Gateway Today. All right, thank you. Well, we're excited to have her on the team. Our thanks goes out to Dr. Sarah Modi for sitting down and talking to us about her experience in joining Gateway Community Health Center. If you want an appointment with Dr. Modi or any of our other physicians, make sure you head over to our website, gatewaychc.com, or call 956-795-8100 to set up an appointment or become a patient of Gateway Community Health Center. Remember, if you want to catch a full rewind of this episode or any of our other Gateway Today episodes, make sure you head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.